heart disease, type 2 diabetes, Alzheimer's, arthritis, most cancers. These conditions look completely unrelated, but researchers have identified a common thread running through nearly all of them: chronic, low-grade inflammation. Unlike the inflammation you feel after spraining an ankle, this kind is silent. You cannot feel it directly. It builds for years, sometimes decades, quietly damaging tissue before any diagnosis appears. Researchers now have a name for this process: inflammaging, the chronic inflammation that accumulates with age and is increasingly understood as one of the central drivers of age-related disease. Today, we are going through what the peer-reviewed research actually shows about 7 natural compounds with documented anti-inflammatory mechanisms, not folk remedies, compounds with human clinical trial data behind them. To understand why these compounds matter, you need to understand what inflammation actually is at the cellular level. Acute inflammation is your immune system's emergency response: redness, swelling, heat, pain. It is protective. It clears pathogens and begins tissue repair. This kind of inflammation is meant to resolve within days. Chronic inflammation is different. It is a low-grade, persistent activation of your immune system that never fully switches off. Researchers measure this using biomarkers like C-reactive protein, or CRP, and inflammatory signaling molecules called cytokines, particularly interleukin-6 and TNF-alpha. A landmark 2019 review published in Nature Medicine, led by researchers including Luigi Ferrucci at the National Institute on Aging, described inflammaging as one of the 7 pillars of aging, concluding that chronic inflammation is not merely correlated with age-related disease, but appears to be a causal driver of it. This is why the compounds we are about to cover matter. They are not treating symptoms. The research suggests they intervene in the actual inflammatory signaling pathways. Curcumin is the active compound in turmeric, and it is one of the most extensively studied anti-inflammatory compounds in nutraceutical research. It works primarily by inhibiting NF-κB, a protein complex that acts as a master switch for inflammatory gene expression. A 2017 meta-analysis published in the Journal of Medicinal Food, reviewing multiple randomized controlled trials, found that curcumin supplementation significantly reduced CRP and other inflammatory markers compared to placebo. The critical caveat: curcumin has notoriously poor bioavailability on its own. Studies consistently show that pairing curcumin with piperine, found in black pepper, increases absorption by up to 2,000%. Based on research from Shoba et al., published in Planta Medica. Omega-3 fatty acids, particularly EPA and DHA found in fish oil, are converted by the body into resolvins and protectins, specialized molecules that actively resolve inflammation rather than simply blocking it. A 2021 clinical trial published in the journal Brain Behavior and Immunity found that omega-3 supplementation reduced inflammatory markers, including IL-6, by up to 14% over 4 months in older adults. Look for a combined EPA and DHA dose of at least 1 to 2 grams daily, and choose triglyceride-form fish oil, which research shows absorbs better than the ethyl ester form used in many cheaper products. Quercetin is a flavonoid found in onions, apples, and capers, and has gained significant research attention for a dual role. It is both anti-inflammatory and senolytic, meaning it helps clear senescent cells, a topic we cover in depth in Friday's video. Research published in 2016 in Nutrients demonstrated quercetin's ability to suppress pro-inflammatory cytokine production by inhibiting specific inflammatory enzyme pathways, including COX-2 and lipoxygenase. Quercetin also has notably synergistic effects when combined with curcumin. Several studies suggest the combination amplifies anti-inflammatory effects beyond either compound alone. Resveratrol, found in red grape skin and famously linked to the French paradox, activates a pathway involving SIRT1, the same sirtuin pathway connected to NAD+ that we covered in last week's video. This is one of the reasons longevity researchers view resveratrol and NAD+ precursors as complementary. A 2017 systematic review in Nutrients found resveratrol supplementation reduced CRP and TNF-alpha levels across multiple human trials, particularly in individuals with elevated baseline inflammation. Bioavailability is again a limiting factor. Look for micronized or liposomal resveratrol formulations, which clinical pharmacokinetic studies show absorb significantly better than standard powder capsules. Astaxanthin is a carotenoid pigment, the compound that gives salmon its color, and is one of the most potent antioxidants studied to date. Research suggests its singlet oxygen quenching capacity is significantly higher than vitamin E. A 2018 clinical study published in Marine Drugs found astaxanthin supplementation reduced oxidative stress markers and inflammatory cytokines in healthy adults over an 8-week period. Because chronic inflammation and oxidative stress are deeply interconnected biological processes, astaxanthin's antioxidant action provides a complementary mechanism to the direct anti-inflammatory compounds already covered. Gingerol, the bioactive compound in ginger, inhibits the same NF-κB pathway as curcumin, but through a distinct mechanism, alongside suppressing COX2 and 5-LOX inflammatory enzymes. A randomized controlled trial published in 2020 in the International Journal of Preventive Medicine found that ginger supplementation significantly reduced CRP and IL-6 levels in patients with metabolic syndrome over a 12-week period. Ginger is well tolerated even at higher doses and has the added research-supported benefit of improving gut motility. Relevant given last Friday's discussion on gut-driven systemic inflammation. Spermidine is a naturally occurring polyamine found in wheat germ, soybeans, and aged cheese and has become a significant focus of longevity research due to its role in activating autophagy, your cell's internal cleanup and recycling process. A 2018 study published in Nature Medicine, led by researchers including Frank Medeo at the University of Graz, found that higher dietary spermidine intake was associated with reduced inflammatory markers and was linked to reduced cardiovascular and all-cause mortality in a large observational cohort. Spermidine is unique on this list because its primary mechanism, autophagy activation, works upstream of inflammation itself by helping clear damaged cellular components before they trigger an inflammatory immune response. 7 compounds is a lot to take in, so let me give you the practical synthesis. These compounds cluster into 2 functional groups. Curcumin, quercetin, resveratrol, and ginger directly inhibit inflammatory signaling pathways like NF-κB. Omega-3s and astaxanthin work through resolution and antioxidant mechanisms. Spermidine works upstream through autophagy. You do not need all 7 simultaneously. The research-supported starting stack, based on strength of evidence and synergy, is curcumin with piperine, omega-3 fish oil, and quercetin. These 3 have the most robust human clinical trial data and well-documented complementary mechanisms. As always, this is not medical advice. If you take blood thinners, several of these compounds, particularly curcumin and omega-3s at high doses, can interact with anticoagulant medication. Discuss any new supplementation with your physician, especially if you are on prescription medication. I have linked the specific products I have reviewed against the dosages used in the clinical trials referenced today: sublingual, micronized, or piperine-paired formulations where the research supports it. Chronic inflammation is not an inevitable consequence of aging. It is a measurable, modifiable biological process, and the research behind these compounds is genuinely encouraging. On Friday, we are going deeper into one specific outcome of chronic inflammation: senescent cells, sometimes called zombie cells, and the emerging science on senolytics, including quercetin's role in clearing them. If today's video was useful, that one will connect several pieces together. Subscribe for peer-reviewed science twice a week. All studies referenced are linked below. I will see you Friday.